Okay,
Okay,
it
got
looks like we are live. Good morning, good afternoon, good evening, good middle of the night to those of you that are joining from wherever you are in the world. Thank you so much for being here. It's such an exciting day and an exciting topic that we're here to talk about today. I'm Jane Bullen, Managing Director of the Nutrition Network, and I'm joined by Dr. Neville Wellington, our Medical Director, Diabetes Medical Director, and an extraordinary patient, Ziska Baumgarten. Welcome, both of you, and thank you for being here. So, sure, just where do we start with this one? Firstly, thank you to those of you that have supported us so wonderfully over the last couple of days. This is a really, really important weekend for us. I'm going to call it our give back weekend, even though it is the Black Friday weekend. I've always hated Black Friday and been anti it, but it has been something that really has been an opportunity at the Nutrition Network to allow people to get their CPDs and to participate in trainings at a reduced cost. So thank you to everyone that agrees to let us do this and to those of you that buy into this. And I want to introduce, obviously, Dr. Neville Wellington, you all know, those of you that are here have probably done some of our trainings, but just to kind of outline, obviously, Dr. Wellington is a diabetes expert. He runs a large practice in Kenilworth, Cape Town, South Africa. He's got, last time I checked, he had 15 GPs on his team. Is that still correct?
no, it's myself plus another 13. So yeah, we're 14.
So there are about 14 GPs and some diabetes educators, coaches. It's an amazing, amazing practice in place. It's treating thousands of patients a month that typically have diabetes, but obviously all other things as well. And I met Dr. Wellington long before the Nutrition Network began, and I went and sat in his office. He was on the board of the Noakes Foundation, and I looked up at looked at the charts that he shows in many of his talks and said, you should not be treating patients, you should be training doctors. So here we are, I think 10 years later, and we've got much closer to that goal, but maybe we'd like to give you even more of that. So amazing to have you here, Neville. And of course, you're here because you are Ziska's doctor at the moment, newly established medical doctor. So Ziska, I want to come to you straight out and ask you to just tell us your story of the last month and what's happened in your life.
Towards the end of October, I thought I had a bladder infection. It was an extremely busy time in my work life. And I thought, no, it's just not going away. And I really do need to make time to go see my GP and just ask her to give me some antibiotics so that this bladder infection can go away. And I sat in her office and she said, okay, well, just, do a urine sample. And she got the test sticks and she put it in, and I saw her face change and she was going, yes, well, no, not a bladder infection, but there's something serious going on. Your sugar levels are really, really high. What's going on? And I said, well, I don't know. She said, well, you need to go for fasting glucose and insulin tests right away. So I went the very next morning and they came back and yes, sure, my sugar levels they were in the 20s at the time, but and I was in complete shock. I really didn't know what to do. So I phoned my very good friend Jane. And Jane, you were just marvelous because you immediately got me into action, which meant, right away get a continuous glucose monitor, which has been really amazing to see what exactly when I eat, and not just what I eat, but when stress affects me and how it impacts on my blood sugar levels. So yes, I immediately got the monitor. You put me onto Dr. Wellington. I put me onto the trainings, and immediately I could step into the right direction and make the right choices for my health. And it has been a really amazing journey these last 3 weeks.
So let's just talk about that initial diagnosis and what happened there, because you said you were in the 20s. Which is
when she tested it in the office, it was 18, my blood glucose, and the blood test results came back around the same, and so when I started wearing the monitor, I wanted to, for a day or two, not change what I was eating because I wanted to really see how it was affecting. And I can remember the first day I wore the monitor, we had pizza for supper, and I could see it go up to 24, and I'm going, what on earth is so that was my highest reading since getting the monitor was pizza evening, and it was 24. And so, yes, seeing in real life what happens, it made it so much easier to change immediately. So there was no more bread, no more pizza, no more any of the quick meals that's so easy to grab. So but I also then I had salad for lunch, and then I went, but my blood sugar went up, what happened? But then you look what's in the salad, and it was a shop bought salad, and it had carrots and beetroot in it, and so, you know, Dr. Wellington explained that for now cannot be eating the root vegetables. So, you know, cleaning up the diet, it wasn't overnight, but in the first week I just cut the refined carbs immediately, and then what I thought was still okay, like the vegetables and the fruit. So for one thing, I love cherries, so I thought, okay, just 5 cherries, but then you can see how it spikes your blood sugar right away. So yes, just cutting out the things that I could see was not good for me. So the monitor really helps, because you can really see immediately, or within the hour, what you ate and how it affects your blood sugar levels.
Okay, I'm going to just jump in here and say, obviously, for me, Ziska's, for those of you that don't know, Ziska's a good friend of mine. And obviously, I was devastated when I got this call, because I know the health journey, you've been on a very long health journey over the last years, and you've really turned a corner and found incredible health and weight loss in the last year. And you were told that you were probably or most likely type 1 diabetic at the time when you called me, and you said, I'm type 1 diabetic. So let's just talk about that. I mean, so you were diagnosed as, obviously your blood sugars were out of control, you were told you were type 1, most likely type 1 diabetic, and you were heading, when I spoke to you, off to an endocrinologist, and you would have been given, I'm sure, insulin to inject and gone down a different path. Neville, thank goodness, Dr. Wellington stepped in and found a slot in his very, very busy calendar at this time of the year. Talk to us about what you saw and where Ziska's at, and, you know, kind of what your experience has been. This feels so important because it's the work we do.
Yeah, so obviously it was, I saw Ziska, and she'd already started this journey and had already been started changing carbohydrates, and you could see from the monitor, and I've actually got it in front of me, that right at the start, there were lots of spikes, lots of, and the baseline was quite high. And I think that was what you know, immediately you change something, you think, oh, I need to get everything must go back to normal. And, you know, it's not fair if I eat a slice of bread that it suddenly spikes so much and it stays high for so long. And I think that was the first thing you were concerned about. The second thing was obviously the thought of whether you needed to be on insulin. And I think we could see very clearly that because of your response, you weren't a type 1 diabetic. And in fact, I can't remember if you did the antibody tests.
No, I didn't.
Yeah, I didn't think we needed to do it, because it was fairly clear that you were definitely not a type 1 diabetic, in that your glucose levels were responding quite quickly to your change in diet. They were starting to come down. We could see quite a good response. Your fasting levels were starting to improve. And really what we just needed to do was just give it time. And the important thing was really that, and I think this is a learning curve. You know, I think I showed you one of the patients that I feature in the textbook, who, you know, had been on a journey, spiked his glucose levels right into the 20s, 30s, and then took about 3 or 4 weeks to come down. And I remember him phoning me after like a week and say, it's plateauing out, you know, it's not changing. And I said, just hang in there, you know, things have it's taken a while to get you. It's going to take a while to get this back. And I think that was the important thing. And I remember phoning you even after our visit, and you were saying, and I could see, yeah, it was sort of plateauing a little bit, but it was coming down. And I phoned to say, well, you know, it's looking good, you're doing well. And you were going, oh, I feel so bad. It's not happening. Nothing's happening. and I think the thing is, when you're scanning on, you know, like hour by hour, and you're thinking things are taking so long, but then you have a look at it over a period of time, it's amazing how our body actually starts to heal. And I think we saw that, and I think that gave you a little bit of hope to carry on, because then a few days later, wow, your sugar levels are almost normal again.
Yeah.
And I think it took about 3 weeks in total, would you say?
Yeah, think you phoned me after the second week. It was a Friday, and I can remember that day particularly, I felt very disheartened because I thought that I was doing all the right things, but I wasn't really seeing a big change. And you phoned, and it made the encouragement of that phone call was truly life-changing, because I was at a point where I was going, well, what am I doing all this for? It's not really having an effect. And then you said, well, just hang in there, because I can see it is changing over the long, when you look at the longer period, it really is coming down. And I think if you hadn't phoned, I would have had a blowout, like, I don't know, carb meal that night, and it would have all gone down the drain right there. So thank you for that encouragement. That encouragement was huge. And just keeping on what I was doing, and then a day or two later, it was like I could hit the green band, and it wasn't difficult anymore, and it was coming down, and it was staying down, and I had no more of those ups and down spikes. Yeah, so thank you for that. That made a huge difference.
So
I think the learning from that is that it actually takes a bit of time for the liver to become insulin sensitive, and for you to actually almost utilize the fat that's in the liver, and kind of get rid of it in a way. I think is, and that's the studies that Roy Taylor, the low calorie guys, show that even over 2-3 weeks, you go on a low calorie, low carb diet. We know it's low carb because they all like hit about 50 grams. And they lose about 25% of their liver fat, and suddenly things start happening, and the magic starts happening. And we started to see that with so many patients. You just have to keep encouraging them to hang in.
So that's of course why we train coaches. So those coaches that are out there, this is such an affirmation for the work that you do. I mean, obviously, I'm incredibly excited about this. I saw Ziska on Saturday, and she tapped her arm, and her glucose was 4.8. And I could not actually believe that it was possible that this was the same person that a month ago had 24. And she thought she was a type 1 diabetic. And that we all know what the trajectory is when one reaches that point of diagnosis. So I really wanted to just jump on, and for everyone that's, of course, all of the doctors that are out there that are part of our network already, you will do this work every day, and you know this. So this isn't a surprise to you. You have this with your own patients. But for those of you that aren't, if you see this, it's just a message of hope that in 3 weeks, somebody has reversed their diabetes. And so Ziska, are you on any medication? And can I ask what your health journey was before and leading to this point?
No, sure. I have been on a almost lifelong health journey. I was diagnosed with Hashimoto's in my 20s. So have been battling the underactive thyroid for many, many years, and have in my 40s, or even just when I turned 50, realized that it's something that I have to control and manage, and that I can't just rely on a medication to do it for me. And I think the same is true here. So yes, for many years I was on T4 medication, which is the most common one for patients with an underactive thyroid. And I kept saying to my doctors, but look, it just doesn't feel like it's any different on or off the medication. I just feel the same. And so I read up quite a lot, and I joined a lot of groups, and just learned what I thought might work for me, and then went back to my doctor. And so eventually, after many years, I'm now on T3 only medication. And don't want to get too technical about all of that, but yes. So what happened was, so in about 2020 was when I made the change, 2021. And I felt so amazing, finally having a body that's responding, that's working. I really, when I turned 50, started exercising for the first time in my life, really, because I hate exercise. But I found a way, and I found things that I could do that wasn't horrible. And in about July this year, bought a mountain bike, and found, because we live in the winelands, and we are so privileged that I can literally ride out my front door and be in the winelands and in the mountains and fresh air and nature, and found that it's something that I really loved. And I would never have thought that I would be that person. But then I also started losing this weight, but I thought I'm doing the work. So it's, and I said to Dr. Wellington when I saw him in our consultation that it almost feels unfair that it turned out to be a symptom of having diabetes, that I was losing all this weight and not the work that I was doing. But yeah, very happy to say that I will maintain the weight loss that the diabetes shock has caused, and just by eating well and exercising. But yeah, so the main thing that I wanted to say is that it has been a very long time, and that I think I relaxed because I used to be very strict paleo diet because of my Hashimoto's and because of the autoimmunity and wanting to keep inflammation down and all of those things. And when my body responded so well to being on T3 medication, I thought, okay, well, now I can eat anything. And I made a big mistake because it has proven to be, not so. And I should have known. It's just that I took a time out, I think is what I'll call it, of not being so careful about what I put into my body, because I cannot expect my body to work perfectly and to have the energy and the stamina that I need when I don't feed it what it needs.
But were you aware of your blood sugar control challenges? Because it sounds like you've had a lot of medical intervention throughout your health journey. Did you know that you had prediabetes?
I've done blood tests fairly regularly throughout my life. Because of the underactive you need to be able to check your levels and so on. And with those levels, I've always checked blood sugar, but I wasn't I knew I was insulin resistant. I just didn't really go into what that meant. So I wasn't careful enough. And also, I think Dr. Wellington had a look at my previous blood results and saw that I was actually probably diabetic already in 2021, but I wasn't aware of it. So sadly, between not being aware of what my blood sugar levels really should be, so I was told maybe they're a little bit high, so you're insulin resistant. So, but my doctor at the time didn't give me, I think, a good enough push towards really not going
so
down.
Neville, what do you have to say about that? Because it feels like this is a gap in care. Certainly not at your practice, but in probably almost every practice I've ever been a patient at, in most of my life. And clearly Ziska, who I know has been on a very, very rigorous health journey and watches her health carefully and eats healthily and is a healthy person. I mean, how has that been missed for so long? And what should we be doing other than, of course, the work that we're doing at Nutrition Network to try and change that in medicine? There is a gap in care here, or in a gap in early warning monitoring.
I think part of it is just the busyness of doctors in their practices, in that they'll look at a glucose reading and think, well, it's kind of up, and the sort of almost feeling that you've got a touch of diabetes. Your sugar level is 7.2, and it's a little bit high, but it's just over the range, and we're not really like diagnosing you, and you just need to watch yourself and exercise a bit more. That's the kind of usual thing. And it's only when it's really high that doctors sort of react, like when it's 10 or 12 or and HbA1c is also, it's in a busy consult, the doctor will say, it's a little bit up, but we'll check it again, so but they don't come back to it. And actually, by the time you get there, you've actually quite a long way down the road. And that's what I think I've learned that, and I think doctors are starting to learn that now. But the honest truth is, I think for many GPs, so I'm not trying to defend them too much, but I'm defending them a little bit, because it's so busy with so many other factors, and I guess it also depends on what the doctor's really what his bent is. So and diabetes is complex in terms of treating it and really spending time, which is what I do, because I end up spending a lot more time with patients, and I obviously take it far more seriously. And obviously I believe that the root of diabetes is the root of so many of our issues. The poor diet, the high carb, the high sugar drinks, etc., that we pour into our society. But we tend to box them. Blood pressure is one thing, and cholesterol is another thing, and diabetes is another thing. But they're all actually related, and and then possibly doctors aren't always aware of the criteria as to exactly how you diagnose diabetes, and those are fairly well known now, but not everybody always pays attention to them. I've spoken to a few doctors at the time and asked them, are you sure you know what the cutoffs are? And they'll give you something and you say, it's quite right. But so I think they're not 100% sure themselves.
So tell us what those are while we've got you. So for patients and doctors listening, what are the early warning cutoffs, and when should they be taking it seriously? At what points?
So I mean, prediabetes would be a fasting glucose. So anything between 5.6 and 7 is prediabetes. So already you're on the track. So if it's above 7 and it's a fasting level, that's diagnostic of diabetes. And the guidelines say you should test that twice within a 2-week period. If your HbA1c is above 6.5%, then that's diabetes. That's the worldwide criteria. Under between 5.7 and 6.5% on diabetes on a HbA1c is prediabetes. So anything actually for glucose and HbA1c, even though they're not the same numbers, they're millimoles per liter. Well, in our country we use millimoles per liter. In the US they use milligrams per deciliter. You just have to multiply millimoles per liter by 18 and you'll get to your milligrams per deciliter. But HbA1c is pretty much the same around the world in terms of percentage, the percentage number that makes the difference. So, and then you can do oral glucose tolerance tests. I don't feel that useful because I don't like giving patients 75 grams of carbohydrates. And then, and there's a whole lot of criteria you've got to do before you I was reading the other day, you actually have to be eating 300 grams of carbs for 3 days before you do a glucose tolerance test. I mean, nobody does that.
Oh, dear.
And so we, we just stick to fasting glucose or just a random glucose. A random glucose above 11.1 is diabetes as well. So that's the cutoffs. So 6.5% HbA1c, 7 millimoles per liter glucose, and 11.1 as a random test. That's as easy as you go.
So I mean, I think that what's scary is that someone like Ziska, who is so health knowledgeable and watches her health, watches her everything, got to 24. And that was what was so horrific for me, and why I feel so excited. So Ziska, your glucose, in my understanding, are between 5 and 6 at the moment. Is that correct? Neville's going to
mostly, yes. So
the comments are right there. So could we actually say that you are now not diabetic? I mean, if you were to go in today, Neville, if Ziska walked into your practice and you weren't aware of the last month, you would not diagnose her with diabetes, would you?
Yes and no. Fasting glucose levels are still a little bit on the high side. Mm-hmm. And that part actually takes the longest to come down. In fact, that's months, possibly even years, for that fasting glucose to actually get down under 7 or even under 6, which would be ideal. But, if I tested her through the rest of the day, yeah, she wouldn't fit into the diabetic range. And that's the truth. So we often see this little dawn phenomenon in the morning. Patients rise, hit about 9. Yours isn't doing too badly at all, Ziska. And it's already responded. And that's the beauty. The earlier you get somebody onto a low-carb diet and get them to change their diet after diagnosis, the better it is. And the much bigger chance we have of patients going into remission. I think I'm busy trying to correlate my stats for the year because I've been keeping quite strict stats this year, finally getting my programs going. And I think almost every one of the new patients that I've diagnosed this year have gone into remission. So, if I can get hold of somebody early enough, we can do something. But it's, once you get beyond 6 to 10 years, it becomes a bit more difficult to get fully into remission. And you bounce back very quickly. Whereas if you're in, once you've kind of gone out of remission from diagnosis, you can probably leave, and I'm not trying to give anybody permission here to go back and eating what they like, but you probably could tolerate a bit more carbohydrates after a couple of, after a year or two. But having said that, I'm not saying you should go back to just doing what you like, or as you said, Ziska, just eating freely.
Yeah.
So it feels like here what we've got is some kind of a magic formula. And what is that formula? So obviously it's the patient that is receptive and able to make a dietary change in Ziska. I know her well. She's got German origins. She's very disciplined. So she obviously managed to take on the information and change very quickly. It was the shock of the diagnosis. It was so bad that I think she was shocked into really changing quickly. It was a coach. I am a coach and I kind of know her well, and I jumped in and started saying, do this, do that. It was the continuous glucose monitor, and it was the doctor. It was Dr. Wellington. It was the right doctor that understands diabetes that got her at the right time. And the combination of these factors, as well as Ziska did our diabetes reversal training via the Nutrition Network, and she's done Neville's training, which is a patient's guide to blood glucose management. So between this kind of multifaceted combination of extraordinary things, you have reversed your diabetes in 3 weeks. And of course, what I'm hoping is that we can find ways to support the world to have this level of this team, or this kind of combination of assets available to them at the point of diagnosis, so that they can reverse their diabetes and that they don't go down the terrible path of being told they have a terminal disease, and that we're heading in the direction of, if not immediate insulin and the wrong diet, which is where Ziska could easily have landed. So I guess what I wanted to do this live just as a call out and a reminder, to our doctors that are on our trainings, to those that haven't done them, to actually see this and to go, there is a way that we can build a toolkit that is going to support patients to reverse their diabetes quickly and not have to go down the trajectory of chronic disease for the rest of their lives. We obviously have got our amazing sale on at the moment. So if you're interested in diabetes reversal, and patients, if you're interested in doing the patient training, they are heavily discounted for another few hours. It's the last day. If you're in America, you've got longer hours. It's almost the end of the day in South Africa and in the Southern Hemisphere. If you're in the Northern Hemisphere, you're a bit luckier. You've got a couple of hours, depending what time zone you're in. Those are still available, very heavily discounted, as are most, if not all, of our trainings. The Pathways to the Society for Metabolic Health Practitioners is heavily reduced. That's the only one that's got our new ketogenic training discounted. So if you buy that bundle, you get them all discounted. And I guess my wish is that we could find a way so that every person firstly, that you didn't have to get to blood glucose of 24, Ziska. And I know that you went to a doctor a couple of years ago that I recommended, and your glucose was high then, and it wasn't taken seriously and it wasn't addressed. So you could have 2 years ago totally avoided this. But the fact that we got it, you got it, and you've reversed it so quickly is such a testament to, Neville, your work, to the work of the Nutrition Network, and also just to the power of diagnostics. The fact that you got a continuous glucose monitor on your arm and you had the knowledge and the support to do this is so extraordinary. So I'm just so unbelievably in awe at what you've done. And I'm going to say it's a diabetes reversal in 3 weeks, not even a month. But the doctor's a bit more pragmatic and saying there's still some work to be done. So Ziska, what advice do you have for people when they hit that moment where they are told by their doctor, you are diabetic, you probably type 1, you go, off you go to endocrinology? What would you say they could do? What support do you think they need?
The thing that really helped me and worked for me was that, 1, I had you as a coach. 2, that I could do the Nutrition Network courses, because that is really step 1 of getting the information I needed, knowing what to do next and how to help myself. And then having a doctor like Dr. Wellington, who really understands and is willing to work with the patient to reverse the diabetes and not just go the medication route, to really look at what I'm eating, advising, looking at all the factors together. And that, I would say, is like a golden triangle. It's having the courses, having the coach, and having the doctor, who are all willing to work with the patient to help themselves.
Brilliant.
So
Yeah.
amazing. Anything to
Yeah.
add to that, Neville?
No, I think it's just, for me, it's about the patients also being willing and actually being willing to do a bit of the hard work. I mean, we're living in a world where patients are getting injections which are supposedly helping them eat better and lose weight and reverse their diabetes, but actually it's trying to take a pill without having to do the work. And actually the better way is to do the work, and actually things turn out better, and it's less expensive. So coming off medication and doing it properly is maybe a little bit of work to start with, but the rewards are much better.
It really is also, and I think what you said, it is less expensive, and it is just, we live in a society where we want the quick fix, but actually when you're willing to put in the work and look at the long-term picture, then you're saving money and you're getting a better outcome in the end.
So Neville, what are you obviously work with diabetics every day, and you have I'm sure a basket of patients that succeed and then a basket that have fallen off and that don't succeed, and you have to take either more medication and different routes to them. What are the criteria for success for patients listening? What do they need to do to get it right so that they don't fall off into the other basket?
I think it's not just one thing. It's almost everything. It's not just monitoring. I think that's helpful. It's very helpful. It's not just eating correctly. It's not just having good family support. Not just having a coach, not just having a good doctor. It's actually kind of got to be everything. And then the patient themselves have to believe it. They honestly have to start to believe. And the problem is they have to overcome a lot of other voices that are telling them, fat's the problem, and but you can have a little bit of that. There's so many other voices that come at you. So for patients who really do it, and actually also have to really, I mean, the work of looking at your numbers, and I think Ziska, you did that, of actually seeing, when something spikes your sugars from 6 to 14, you can't unsee that, and you can't say, well, it didn't happen. Numbers are facts, they're truth. They, so you can't get away from them. So eventually it becomes a choice of, well, actually I don't want to do it, and some patients just get there. So I understand that. So we have to try and work out other ways of trying to get them to get there. But, we did a little study a couple of years ago. Jane knows Sophia. And one of the things she found when she analyzed just the psychological impact for patients, the patients that were most successful had something called grit. That's what she termed it. They really kind of stuck it out. They showed that they were able to go through the difficult times. And I think that's the important thing, is really just getting through the difficult times. And we helped you get through that, Ziska, and then you carried on. So we have to find ways to encourage people as well, and that's, I think, where coaching is so important.
Yeah, I agree. That is really, because, like you said, Dr. There's so many different voices, and you really do, come across articles, and people can be very discouraging. No, you can't eat all that fat, or you can't eat the skin of the chicken, and you start doubting the things that are working. So coaching really is, I think, a key part of the success of diabetes reversal.
So Ziska, you obviously work in an environment of, I didn't introduce you properly, actually. Ziska owns a brand called Taste, which has one of the best, I think it's probably one of the best ice creams certainly I've ever tasted. I'm not a big ice cream eater. I try not to eat sugar, but she makes a sugar-free one. But my partner and my son, literally, we travel an hour sometimes for them to have one of Ziska's ice creams. So how have you done it? Obviously, you're constantly around sugar. Like, are you managing, if there's anyone that's exposed to temptation, and I think you probably have to taste your actual recipes at times, are you managing, is it possible for somebody that's around the best ice cream ever? How is it out?
Yeah, no, somebody said, isn't it ironic that the Roma-Stani is now off sugar completely? I luckily I've been doing this for a while, so my regular recipes I don't have to taste. But whenever I do a new one, I do just need to check that everything is balanced and flavor profiles are right. But I literally have a teeny tiny teaspoon that I use, and I try and do as little of it as possible. And I remember the first time on my notes that I put with my monitor, and it was a churn day. And yeah, just on churn days, my levels are a little bit more erratic. But I do try not to taste anymore. And in fact, I wear a surgical mask when I'm churning, so that there are no accidents of anything landing up in my mouth. But yes, it is. Yeah, I work with sugar every day, so it is very funny. But yeah,
there's no excuse for those of you that struggle. For those of you that struggle not to buy the Mars bar at the checkout, somebody that actually makes ice cream every day is managing. So you obviously have the grit. Okay, I want to thank you both so much. I just feel so excited by this story. It feels like such a personal reason to celebrate somebody that I love and that's close to me that really has just done this without much effort. I mean, of course, it's been hard for you, and this isn't an easy thing to do, but to see you a month ago, you were resigned to the fact that you might have diabetes, type 1 diabetes. We're heading off to a hospital, and a month later you are presenting as a non-diabetic. So huge, huge respect to you, and to Neville for the work that you do, and just for the support that you offer patients. You are such a rare doctor. Of course, not as rare as you were 10 years ago because of the thousands of doctors that have done the trainings that you teach on at the Nutrition Network. So thank you so much for your kindness and your generosity. I think you really embody the spirit of Thanksgiving to a large extent. Both of you do. Yeah, so those of you that are listening, thank you so much for joining. Please ask any questions for future lives if you have them, for any of our doctors and for Dr. Wellington. Join any of our trainings if you can quickly before the end of the sale. Be a part of our community, engage, ask, find a way to create a practice that really sees results like this and that changes lives in the way that so many people around the world are doing. We look forward to working with you and meeting you. Thank you both so much.
Thank
you, Jane. Well done, Ziska. Keep it up.
Thank you.